Government has signed the Health Workforce Compact 2024 to 2026, a commitment to accelerate investment in health workforce development and to enhance collaboration across sectors.
The Minister of Health and Childcare, Dr. Douglas Mombeshora, says there are 5 strategic areas that will guide the country's efforts to strengthen its health workforce. Among other things, an equal geographic distribution of health workers must be addressed to bring efficiency in service delivery.
On the 5 strategic interventions, which are 1. Health workforce education, training and development. 2. Health workforce deployment, utilization and governance. 3. Health workforce retention and migration management. 4. Health workforce monitoring and evaluation, ICT research and innovation. And 5. Health workforce planning and financing.
He added that the health workforce strategy is meant to transform the country's human resources by addressing gaps in the sector. So, can this be achieved?
These include efforts to increase capacity to train health workforce, strengthening mentorship programs, adopting of e-learning methods in selected curricula, facilitating learning through fellowship programs for critical shortage areas and the integration of nurses and other critical cadres to the public health system to fill in the gaps in the short term. In addition, government will incentivize deployment of selected health cadres to hard-to-reach areas.
Skills Audit and Development Minister Professor Paul Mavima stated that they are aware of the shortage of skills in the sector.
We need to do 2 things. 1, to make sure that we continue to train and even double, like the chairman of the Health Services Commission indicated. We need to double our efforts at training. Secondly, we need to make sure that we have offered remuneration levels that will allow our health professionals to remain in the country. Let me add a third thing that we have to do. We have to develop bilateral agreements, especially with the destination countries where our people are going, so that there can be some level of compensation for them tapping into our trained and skilled human capital.
Speaking on behalf of the Finance Minister, Ratizo Mutonono said the ministry recognizes the importance of health financing. She said the strategy will guide their efforts in expanding the sector.
The Health Resilience Fund, launched in January 2023, is a testament to our commitment to improving health outcomes. This fund will contribute to improving health care for vulnerable mothers, newborns, children, and adolescents. The Zimbabwean Health Workforce Compact will guide our efforts to expand and remain our health workforce.
A representative of the health workers, James Svanda, applauded the government for taking note of existing gaps.
We applaud the government for the realization of the need to improve on numbers of health workforce to come out of training institutions. As much as we want numbers to meet the need, let's not forget that sometimes it is not all about numbers but quality. We urge the government to put in place measures that will consummate quality of product coming out of the training institutions. In this light, it is fundamental that the government retains expertise and experience starting from the training institutions.
Will the strategy help improve service delivery? And will the health sector overcome the challenges it has been facing over the years? These are questions the health workforce strategy could answer. For ZTN Prime, I'm Kimberly Chimbalang in Harare.
Konapo ipapo ba ZTN Prime, DSTV channel 294, the place to be.